Okay, so the first question, we got a lot of questions. We're going to try to get through as many of them as we can. My son is about to be 2, and I have some concerns about his eye contact and his language. We're about to go in for our 2-year-old checkup. I want to ask the doctor to screen him for autism, and my husband is afraid that will make the doctor see something that isn't there. Will the doctor automatically screen him for autism if I don't ask? How will I know if he screened him for autism?
Great and very important question. You should get your concerns about his eye contact and language addressed. Very important. There's no evidence that doing evidence-based screening actually makes doctors see symptoms that aren't really there. It's worth doing the screenings. The American Academy of Pediatrics does recommend that all pediatricians screen for autism at the 18-month visit and the 24-month visit. So if the doctor is following the guidelines of the AAP, they should do screening. The most common screening test is called the Medical Checklist for Autism in Toddlers, revised, or MCHAT. You would know if the doctor's doing it because they would actually give you a paper questionnaire with 20 questions, and it probably would have MCHAT revised at the top. And if you don't get that, or you can't tell if the doctor's screening for autism, I would ask them to screen for autism because it is recommended at that age.
Yeah, and I want to say too, you know, I hear a little bit of conflict here between mom and dad, and I think that that's really common.
Yes.
When we start talking about, is our kid different potentially than we thought they were, you know, you're not going to be on the same page. But here's what I want to say, having been through this and having watched so many other moms go through it, is it sounds like to me that mom wants to ask but is afraid of dad's reaction. And I want to say that if we look at the timeline and go, let's suppose that to make your husband comfortable, you don't ask. And then a year from now, you found out that your child has autism and that you lost that whole year, you will be a lot madder at yourself than your husband has the potential to be mad at you. So I really want to encourage you to go through the uncomfortable with your husband and just ask.
I totally agree with you, Shannon.
Yeah, there's so much at stake here, and I get it. You know, I love being happily married, and I don't always, you know, agree. And by the way, my husband and I didn't agree when I was wanting to get my son screened. He kept saying to me, "There's nothing wrong with him. There's nothing wrong with him." But you know what? There wasn't anything wrong with him, but there was a lot that he needed help and support with, and that's
right.
we got it done.
Yeah, and a parent's denial can be a form of protecting their love for the child. And what I say is denial's okay as long as you still act.
That's a great thing. We need to crochet that and put on a pillow.
Okay.
Right. Okay, moving on to the next question here. My daughter's pediatrician is basically an insensitive idiot, and I am done with him. But how do you really feel, right? I want to find.
I like a straightforward person.
Right. I want to find a new pediatrician. What kinds of questions can I ask to let me avoid getting another idiot? They go on to say he basically told me that all children with autism have no sense of pain, and so he didn't want to give her any pain meds when she recently got stitches, and she wrote, "Done with him." What do you want to say about that, Dr. Copeland?
Children deserve pain relief for painful procedures. So unless there's just 2 quick stitches, and that's unusual that a cut only needs 2 quick stitches, the pain of the 2 quick stitches might be equivalent to the pain of giving numbing medicine. But if there's going to be more than 2 stitches, kids deserve pain treatment. And kids with autism do feel pain, so it's inaccurate to say that they don't. They may have a higher pain threshold, but that's different than not feeling any pain at all. So we do want to be sensitive to their pain and give them pain relief, and you want a doctor who will be open and listen to that. So I'm all about parent empowerment and choosing a doctor you feel comfortable with for your child. So I would talk with the pediatrician and get your gut parent instinct of, are they a good listener? Do they take the time? Do they show caring and compassion? I would ask them what their philosophy of medical care is about and see if it kind of is compatible with your sense of what care should be. And you could ask questions like, are they a member of the American Academy of Pediatrics or their local pediatric medical society? Because that, to me, would suggest a proactive physician who's interested in keeping up to date and so forth. And then ask them specifically about their autism experience. More and more, pediatricians are having more experience with kids with autism because it's been on the increase. And even if the pediatrician says, well, I'm not an expert on it, if they're willing to be open, listen, talk to a specialist like myself, then that can still be a good match.
Absolutely. Our local pediatrician that we adore, the ground that he walks on, we switched to him after a negative experience because my son got sick in the middle of the night and we got sent to an emergency room, and then from that emergency room we got sent to another emergency room. And when I called our pediatrician's office, I got somebody who we'd been in the pediatrician's office that day, and she had said, if things get worse, go to the office. But when we called her office to tell them, we couldn't get anybody who knew anything about my son. We couldn't get anybody who, so we just were on our own. After the office closed, we were on our own. And for me, that was the single most important thing, was that I wanted to know that I could get somebody on call 24 hours a day, 7 days a week, who would have some knowledge of my child.
That is a critical point. Excellent point you bring up, Jen.
And when I asked everybody, who's the pediatrician, that was my first go-to, because I was thinking emergencies because we've been through this. And when I found my pediatrician, and there's 3 pediatricians in that office, but whenever we're there, we just see the one, but they're all on call, and they all carry, I love technology, they all carry an iPad that has all of the kids' cases on them. So if I call at 3 o'clock in the morning, they call
know
me back.
His case.
Yeah, they call me back within 10 minutes, and they've got it right there, and they can look and say, oh, well, before we prescribe this, would you like this prescription for, again, he's tolerated this well, go to this emergency room. And if I say that I'm going to the emergency room, they call the emergency room for us and inform the doctor that we're coming and tell, what allergies and everything. It gives me so much peace of mind to have that component.
Yes.
It's such an amazing thing.
That's good medical care. I love that story. That would be a good example of what you're looking for.
Yeah, and then as a result, because they had that piece, everything else I was willing to work with, but it turned out they've been really, really good for us. But that was the go-to for me, and I bet the other people have go-tos that it's like, well, I can deal with this, but nothing else. And I think, this person who decided that they weren't going to do pain meds, ooh, that makes me mad.
Yes, me too.
We're going to move now to, I love this question because this is how I feel a lot of times. How can we tell if a child has a cold brewing or if it's just allergies? My son is in kindergarten and I hate to send him to school if he's contagious, but I also hate to keep him home if he can be at school. I love this question because I believe, Dr. Copeland, that it's a little bit harder with a kid with autism to know what they're feeling and how they're feeling. A lot of times they'll downplay something, or they might be, more dramatic about something. How do we know what we're looking at?
It is a tough question. It depends on how many hours or days they've had symptoms too. It can be hard in any child to tell in the first 12 hours. But ultimately what I'm looking for is their sore throat. So pain, definite pain. Fever, low grade, could go along with a head cold, although not all viral head colds have fever. But if there is fever, that leads you in the direction of an infection. And then real excessive lethargy and fatigue. Some colds will do that to you more so than allergies. You can be a little tired with allergies or from the allergy medicine. But some of the viruses in the first few days of the cold really knock you for a loop. And then the color of the mucus, and the longer that there's been really thick green mucus. So fever, sore throat, pain, lethargy, thick green mucus, that's getting worse, not better. General symptoms kind of getting worse, not better, sometimes evolving into a cough. That leads me towards it's more likely an upper respiratory infection like a head cold. Whereas with allergies, the mucus is usually a little lighter, thinner, watery perhaps. and there's a lot of itching. So there can be just some discomfort, but it's usually not that, oh, it's so painful to swallow. And there's an itchiness in the throat and the nose and the eyes, and they're watery. They may be a little bit irritable or tired from it, but that to me is more suggestive of allergies.
I love that. We recently, it was maybe a month ago, my son woke up in the morning and he was a little out of it, but some days he's like that. And I sent him off to school. I said to him, "Do you feel okay?" And he goes, "Yeah." And I sent him off to school, and I think it was like about 10:30, the school nurse called and said that he just threw up.
Yeah.
And,
yeah. And that'll happen. That's happened to me before, and I'm a doctor.
Okay. All right. Because
it can be hard to tell in the first few hours.
Because the school is saying to you on a regular basis, it's important that your child is here. And we know that they're saying it's important because they don't want them to miss the schoolwork, but also because, everybody gets funding, and if the child doesn't come to school on a given day, they don't get funding. So we were always told, send them off to school, and if they're not feeling well, at 10:30, the funding is still there for the day, send them home. But the school nurses look at you like you're a criminal. Like, how could you not have known that your kid was going to throw up in 2 hours? I always feel like a criminal.
But you can't always know. That's unrealistic on the part of the nurses. But definitely I would keep them home if there's definite fever or they've already thrown up at home. That's kind of an obvious.
Okay. Very good then. I feel better then that I'm not the only person who can't read whether or not my kid's going to be sick in 2 hours. Okay, so we're going to move to talking a little bit about bowel movements, because that's our favorite subject here at Autism Live. Okay, so somebody wrote in and said, how can I help my child to have a bowel movement when we are on vacation? He won't go or can't go, and we are scheduled to travel for Thanksgiving. So this is a very common tale.
Yeah, that's tough. Part of it depends on the age of the child. So if it's a really young toddler, you might think to bring their favorite potty chair with them. That might help. But can't do that for elementary school child or older. So what you might want to do is bring some glycerin suppositories that you can insert rectally with a glove to help so they're not withholding. That might be something you could do. You could encourage a high fiber diet, but some of our kids are very picky eaters, and trying to encourage them to eat high fiber is tricky. You could actually give them a fiber supplement. And then if need be, on a short-term basis, I think a short-term stool softener like Miralax is okay to encourage them to go. It increases intestinal motility.
Yeah, and I wonder, Dr. Copeland, how much of this is, I know full-grown adults that they travel and things get, you're eating on a different schedule, you're eating different things sometimes. I don't think it's all that unusual for somebody's, you're sleeping at different times, for the whole thing to get thrown off a little bit.
Exactly.
But is there also an element of the behavior thing here that, we don't know from what they wrote.
Good point.
But I know that
and
some
there may be this discomfort of, kind of an anxiety of using an unfamiliar toilet or bathroom. And that's why I suggested for the little toddler to bring their potty chair along.
Yeah.
And then for the older child, that could be addressed behaviorally in their behavioral program. So that was an excellent point.
Yeah, and especially since they've got some time because of Thanksgiving, maybe they could look at doing a program where they practice going to the bathroom short distances away from home, going to Target.
Right. Great idea. No, that's a great idea. It's a community outing, and it's a skill you want to generalize to different settings.
Exactly. I hope Target appreciates that we refer people to train, that we're training people in their bathrooms. Somebody wrote it and said, how much candy is appropriate for a child to get for Halloween? And I'm assuming that they mean over that day and over the next couple of days, because it's gotten kind of ridiculous in terms of when, I don't know how people afford, in our neighborhood, people hand out like a handful of candy into a bag for the kids, and they come home with this huge bag of candy, Dr. Copeland.
I know, and actually even when I was little, me and my siblings, we were ardent trick-or-treaters. We would get huge cases full of candy. It was ridiculous.
It's a lot. So how much is okay? I have no idea what is the appropriate amount of sugar for kids to eat on a daily basis.
Yeah, well, we don't need that much refined sugar. We could use a lot less of it in our diet. And I guess my answer to this question would be it depends. And it depends on if your child has GI issues associated with autism, which can frequently occur. If they've been on a healing diet, have you had to, restrict their diet, be on a healing diet, work really hard to get their GI issues under control over the last year? You don't want to blow it all of a sudden overnight with Halloween candy and the sugar, especially if they've had a lot of yeast issues. So you might think about alternatives. And I know what some families have done is they'll have Halloween parties with like-minded families, and you only have healthy treats there. But there's, for other kids, they may tolerate sugar better, and trick-or-treating and Halloween may be a particularly fun tradition with your family and community. So for kids who don't have the GI issue, I think let them have their trick-or-treating fun. If they tolerate it, okay, I would think maybe 4 or 5 pieces, small pieces, as long as it's not big whole candy bars that are getting handed out these days, more the little Hershey's Kisses or the little Hershey's foil wrapped chocolates, that sort of thing. And you might do that for 2 or 3 days and then give the rest of the candy away. I don't think kids need a piece of candy a day or anything like that. But I think a little bit of the fun and excitement and celebration. And then you have to think, too, about do they have food dye and sensitivities? You might want to stay away from the artificially colored candies. Do they have nut allergies? If they don't have nut allergies, a nut treat with a little dark chocolate, that's actually can be very nutritious and healthy. So it all depends. I've had people make treats with agave syrup or honey, if that's allowed in their diet. And I used to give out kumquats, little tangelos, or little apples as treats. So there's different things you can do.
Well, and we had talked about this during the break, and you had said you knew that I'd weigh in on this, and of course I will. This is coming from a question from somebody who clearly allows their child to have some candy, and I want people to know that, like, if that works for you and your child is okay and you don't get behaviors, I love the advice from Dr. Copeland about, keeping it in a range for a couple of days that's manageable, but giving them the treat. I will say, for those of us who are on the opposite side of this, where we know that our kids can't do sugar, Halloween is just not a sugar holiday in my home, but that doesn't mean we don't celebrate. My kid trick-or-treats and has ever since, he came out. we took him trick-or-treating his first year. And he loves going and getting all the candy because we taught him very early on we have the Lego fairy when he was little. So when he would get candy, and to him when he was 2, it just looked like brightly colored pieces of paper, but it was very reinforcing because they make the labels on them very reinforcing. He just thought it was great. It was sparkly. He had no idea what was on the inside, none. But he knew that he took his little, candy pumpkin and put it on the middle of the dining room table, and the Lego fairy would come and turn it into a Lego.
I love it. So it's a trade. Makes total sense.
And the candy disappeared, and he got the Lego, and it was worthwhile to go get the candy. We still participate in this, even though he's older. And it's a wonderful thing. I know people that have a Barbie fairy, and you can, it can be whatever fairy you want it to be. We just don't participate in the candy part of it. But the funny thing about it is that he participates in everything else. If he goes with his friends and they trick or treat and they go, I got this, just like in the Peanuts cartoon. I got this. I got a rock. I think that's on tonight. In fact, I got a rock. And he'll go, oh, I got a Snickers bar, and he knows that everybody goes, oh, a Snickers bar. He's just not going to ingest it. That's the only thing that's different. But he knows that it translates in, a Snickers bar translates into a bigger Lego. So nothing is
more. I like that.
Nothing is lost except for the sugar part of it. And I will tell you too that we're going to be covering this on the show tomorrow, that there's something called the Teal Pumpkin Project For those of you who have kids that have issues with the colors alone, Dr. Copeland, you brought that up. That can be a really difficult thing for families.
Yeah.
And that if you see a teal colored pumpkin in front of somebody's house, that means they're participating in the Teal Pumpkin Project, which means that they have a choice that is non-edible that they're giving away at the house for a
Nice.
treat.
I like that.
Isn't that wonderful?
So, yeah, because not all kids were happy to get my kumquats.
Well, and and unless you know somebody, there are some parents who wouldn't let them have something unless it's pre-packaged. I know that kumquats are kind of packaged. But, and if people want to know more about the Teal Pumpkin Project, they're on Facebook and they have a website and they give suggestions of things, low-cost things to give away that kids will find exciting.
Very cool. Leave it to you, Shannon.
Well, hey, I didn't invent the Teal Pumpkin Project, but I'm thrilled that more people are realizing that putting 10 pounds of sugar and artificial colors into our kids is not the thing that leads to happy children.
Right, exactly. Americans get way too much refined sugar in their diet. And actually, there's too much refined sugar shipped around the world, and it stimulates the appetite, so it can contribute to weight problems and diabetes issues and tooth decay.
Absolutely. And by the way, since you brought up the tooth decay thing, that reminds me that there are many dentists around the country too, that if you want to bring your candy to the dentist afterwards, they'll buy it from you, or you can donate it and they will ship it to the troops overseas.
All right. Yeah.
So good things to do with your candy. I usually bring it to work. It disappears.
That's where I give mine away.
Right? And bring it to work, and there's always somebody that can handle it at work. Okay, moving on back to, we got to get back to the poop, because it's always about the poop. Somebody wrote in and said there's been white mucus in their son's stool. They said he recently had a cold. Is that something I should be concerned about?
Okay, so if it's just a little bit of white mucus and it's only very recent, it hasn't been a recurring issue, and it's mainly only associated when they have a head cold, but there's no weight loss, no abdominal pain, no fever, no recurring diarrhea, no blood in the stool, I would just monitor it, and chances are it'll be gone when the head cold is gone. Some of the viruses that can cause a head cold also cause a little bit of minor inflammation in the GI tract. So you might temporarily see some white mucus. But it's a totally different story if it's frequent and recurring white mucus. It's getting worse. I got to get the lights back on and being very...
We were doing so good. Dr. Copeland has her lights very environmentally friendly, so that if there's no movement, they'll turn off. So we appreciate that.
So hopefully that'll keep them on.
Yes.
So it's a different story. If they do have the fever, weight loss, recurring abdominal pain, recurring diarrhea, blood in the stool, then the mucus can be a sign of an additional sign of inflammation, and that constellation of symptoms, you'd obviously want to go see a doctor and evaluate for that. But an occasional little bit of white mucus, especially when they have a head cold, chances are they're going to get over it on their own.
So if they are having, because we don't know from the question if they're having any of those other things, but if they are having abdominal pain and those things, is that a trip to the developmental pediatrician, or is that right to a gastroenterologist?
Pediatrician.
Okay.
They may have some inflammation of their gut, their GI tract. It's not that common, but it can occur that children can get various types of what are called inflammatory bowel disease. And with that, they won't grow well, and they may have chronic mucus in their stools and chronic recurring diarrhea and so forth. And that you'd want to see the pediatrician, start there. And if the pediatrician gets stumped, they do a GI referral.
Okay. Wonderful. Now, our next question is about MRIs. A lot of people on the spectrum will at some point decide or talk to a neurologist, and we have people write in on a weekly basis saying that their children have been, they've been asked to do an MRI with their child. But somebody wrote in and said, is sedating our kids so they can get an MRI dangerous?
Well, that's a very good question. It's probably the most complex question of all the questions today. And so there's always risk with sedation. But in medicine, what we do is we weigh the risk with how important the test is and the potential benefits of the test. So if the neurologist and doctor really thinks it's indicated, it may be very important to get the test depending on what the child's symptoms are. And it may be worth the sedation, but the sedation has to be done very carefully, well planned. There should be a medical pre-sedation assessment by a specialist. It may be the pediatrician, neurologist, or a sedation anesthetics team. So there's a lot to consider, and there would need to be a very thorough history obtained. So in the pre-sedation assessment, they would want to know what's the child's health status, what medications or over-the-counter supplements they're taking, the dosing and the timing and everything, including herbs, everything that might potentially interact with the sedatives that they're giving, and if they have any allergies or sensitivities, if they've ever had sedation or anesthesia before, did they have any problems with it? Is there any family history of people who've had problems with anesthesia or sedation? So all of that has to get carefully reviewed in the pre-sedation exam. And then it'd be natural for a child to have some anxiety about medical testing. So there's things that could be done, like sometimes a hospital or an MRI clinic will involve a play therapist. And sometimes they even have mock scanners where the child can practice with the play therapist what it's like to go into the MRI scan. It can be noisy, and it's a noisy environment, and they have to go into a tube, so it's closed spaced. And if they have some claustrophobia issues, that could aggravate their anxiety. And they have to stay still for a long time. An MRI can take up to an hour to do. So if it's a very young child and the test is important, chances are the child is going to need some form of sedation to try and get a good quality test. But you should get all your questions about the sedation thoroughly answered, and you should see that they're taking that really detailed history and doing it with very careful planning to minimize the possibility of any side effects or risks, and maximizing the chances that they're going to get a good quality scan. As I said, for the MRI scan, you have to be very, very still. Now, if you have an older kid who's super cooperative and maybe they're interested in technology and they think the MRI scan is cool and they've practiced in the scanner and they think they can hold still, and maybe they get to listen to headphones or something when they're in the scanner, such a child like that may not need to be sedated. But that's not going to be the majority of kids. The majority of kids with neurodevelopmental issues, global delay, and so forth would probably do better with sedation. And then you have, I don't expect a parent to be an expert in the type of medicines that are chosen. And I'm going to name some names, but you should ask the sedation team or expert, is there going to be an anesthesiologist involved or an emergency medicine sedation team that's highly specialized in the sedation? Are they going to use a short-acting anesthetic like propofol? And also the fewer agents used, if you use 3 or more agents involved in the sedation, the more likely you're going to get side effects. The nice thing about propofol is it's relatively short-acting. It may not be long enough for a full 1-hour MRI scan unless they just give it intermittently IV. Sometimes you have to start an IV. But often you can use it as just one agent, so that's good. They might tolerate it better. Then there's an anti-anxiety medicine called Versed, which is also known as midazolam. And sometimes that can be taken as an oral syrup. Sometimes it needs to be intravenous. So the doctors might even tell you about what agents they're considering. Chances are for an MRI scan, you don't need narcotic agents like Demerol or fentanyl. So you'd want to ask about that. And I thought I'd share, because even before this question was asked, this one parent sent in, I guess their daughter, who's about 10, I think, had to go through some orthodontia procedures recurringly, and they could be pretty uncomfortable. And so she needed sedation. And the first time they sedated her for the orthodontia procedure, they used the propofol small dose, but they also combined it with Demerol, which is a narcotic. And she just had a bad time waking up from the sedation, where she got not only extremely disoriented, but she got really kind of combative and aggressive for 45 minutes.
Yeah.
And then the mother shared that the second time they eliminated the Demerol, the narcotic, and they mainly used the short-acting propofol and some breathable gas. And the little girl was slightly disoriented for about 10 minutes after, but no aggression, no combativeness, and then she was fine. So the mother said, I want to share this.
Yeah.
So I thought, oh, this is the opportunity to do that.
No, great information.